joining me now is Alecia Macrow, who is a GP from Glenelg. Tell me, what brings you to Congress this year?
We are one of 22 federally funded clinics to set up and run a primary care-led team to help people with endometriosis and persistent pelvic pain. So I'm here along with many colleagues from all over Australia, talking about working on our model of care to work with the thousands of women and those assigned female at birth that we work with, suffering with pelvic pain and endo.
There are currently 22 of these pelvic pain and endometriosis clinics funded by the federal government, another 11 to be rolled out. Can you just sort of give us a bit of an example of your day-to-day, what it might look like in the clinic?
So our clinic runs as a general practice as well, so all of us still see non-pelvic pain patients, so it may look similar to any GP, but we will see a new pelvic pain patient for over an hour is their initial appointment with one of our GPs, and then they'll go on and have further assessment and spend time thinking about lifestyle and management with one of our nurses, and then be referred on to whatever team they need, depending on what they need and what their goals are.
What impact are you noticing this is having on patients, having that access to the variety and the team?
One of the most moving things that someone said to me is that working with us as a team has allowed them, their world to get bigger again, and them to start living a life which was more normal for them and more like what they wanted to do. So that's been unbelievable.
Has it surprised you just how many people are in need of this service, let's just say in South Australia alone?
It continues to surprise me, the level of distress that we see. Medical burnout, medical trauma that people who've had really difficult to treat pelvic pain come to see us with. Like, they've often seen many practitioners before they've met us. And one lady in particular came and said to me, "I'm physically, emotionally and financially exhausted." And we were the sort of last bet for her before kind of giving up entirely. And we see that a lot.
What's your message to those that might be listening now or watching at home? What would you say when you do feel that way?
There is hope. Hopefully there'll be more and more practitioners, GPs, gynecologists, physios and others who will be a safe place. And there are layers of things that help with the pain and distress and suffering that someone might have. And we can almost always find a way forward that is going to help them. So don't give up. You may need to try a few different practitioners before you find one that is equipped to help you, but don't give up.